Welcome back to What's the 411 News, where we bring you news observation, interpretation, and news commentary from an FBA and BGR perspective. Let's get it. Welcome, everybody. Welcome back to What's the 411 News. And you guys see it on the screen. Medical apartheid, the unfair treatment of FBAs in health care. All right, we're going to take a look and find out what this is about. But I will say before we get started that medical apartheid towards foundational Black Americans is still going on this very second. I've seen some things with either family, friends, or heard from through other people, and they talked about their family and friends. There always seems to be some type of malpractice and some mistreatment when it comes to one of their loved ones or themselves going to get looked at for whatever reason. All right. So, yeah, we're going to get into it. And let's check this out. All right. For Black folks, medical mistreatment starts young. All right. And you better believe it. You better believe it. All right. From the front desk at the doctor's office to private encounters with physicians, Black children and their parents are more likely than others to face unfair treatment in medical settings. All right. That's the finding of new research from the Urban Institute, a Washington, D.C. based nonprofit research organization. The study, based on data from the nonprofit's Health Reform Monitoring Survey, uncovered multiple disparities among its Black respondents. All right. The most recent data collected in June 2022 had a sample size of about 9,500 adults of varying races, including nearly 3,000 parents of children under the age of 19. So, how common is unfair treatment? All right. More than 1 in 5, or 22% of Black parents reported experiencing unfair treatment while seeking health care over the past year. All right. 10% more than parents who are white, Hispanic, Latinx, or other races. All right. Compared to 3% of all parents, 9% of Black parents reported that their children were treated or judged unfairly because of their or their parents' race, ethnicity, country of origin, or primary language. I'm going to read that again. Compared to 3% of all parents, 9% of Black parents reported that their children were treated or judged unfairly because of their or their parents' race, ethnicity, country of origin, or primary language. All right. So looking towards the future, 40% of Black folks expressed concern that they or a family member will be treated unfairly at a later visit, just like I've just mentioned earlier. All right. That I said that there are people I've known, or people who known of people, their family members and friends. They hear all this stuff all the time. And it's definitely got to come to a stop for sure. Our findings show that some parents, especially Black and Hispanic Latinx, which I doubt that seriously, parents are treated unfairly because of their characteristics when they seek health care. Parents of children under age 3 are as likely as parents of older children to report unfair treatment, the authors wrote. Now, before I go on, I really doubt there's that many Hispanic Latinx that's really getting mistreated. And one of the main reasons is because the Hispanic/Latinx people are looked at as being white more. They're not looked at as being Black. And then you have a lot of Hispanics Latinx, who you have this La Raza thing, up with the race, or which means they want to lighten their color, lighten their skin. They don't want to deal anybody darker than them. So they want to marry either white people or other Spanish, Hispanics that are light, that look like a white person. All right. So let's move on. All right. Changes in the healthcare system will be required to provide high quality, respectful, culturally effective, and evidence-based care to all children and their parents, including Black parents and parents of color. Now, I say that statement right there is like a double talk, double speak, because not everybody's getting mistreated in the medical, healthcare, hospitals, industry. But yet it says changes in the healthcare system will be required to provide high quality, respectful, culturally effective, and evidence-based care to all children and their parents. And then they say including Black parents and parents of color. Parents of color refers to Indian people from India. Parents of color refers to Asians. Parents of color refers to like Hispanics. But again, that is not the problem. They're not having issues. I don't see them coming out and complaining about stuff like that. The people who are complaining, and it's been happening for years, even going back to slavery, where they was doing experiments on Black people, men and women, are actual Black people. So I don't know where they get this. There has to be a change in the healthcare system, and they want to require and provide high quality, respectful, and culturally effective. You know about foundational Black Americans culture. We had the best doctors on the planet when they were allowed to be doctors. All right. Y'all know what foundational Black American culture is. Y'all know our culture. Anyway, let's move on. A long-term pattern of racism in healthcare. So the survey results may not come as a surprise, considering the United States history of racial discrimination against the Black community, like I just mentioned. Forced hysterectomies on Black women in Mississippi, funded by the federal government. Syphilis-ridden shots on Black men in Alabama, also funded by the federal government. And best believe that wasn't the only experiments done on Black men and women, because there were plenty of them. That's just the ones they chose to put out in the books and in the atmosphere and in the social media space and in the mainstream media space. That wasn't the only experiments they done. All right. So let's keep that real. Okay. Let's keep that a buck. Or more recently, the lack of inclusion during post-oximeter trials, a device essential to COVID-19 diagnosis and treatment, which ultimately exacerbated complications among Blacks and Hispanic patients. Again, I haven't heard too many issues or Hispanic people complaining about that. Just last week, family members of the late Henrietta Lacks, we'd already discussed about Henrietta Lacks, all right? So just last week, family members of the late Henrietta Lacks made progress toward getting justice for the Baltimore resident and cancer patient whose cells were stolen by doctors 70, that's 70 years ago, and used to advance global medicine and science. You see what I'm saying? A lot of you Hispanics, a lot of you Asians and you Indians from India, Chinese, Japanese, Koreans, those are all over here in America. You Black immigrants coming from the Caribbean and Africa and other parts of the world, you are getting beneficial health treatment from someone from the United States of America that was black, a black woman. They took her cells and started coming up with these medical improvements. All right. So you can thank black Americans for that. Everyone. And they stole the lady's cells and was making major bank without offering anything to the family members, nor were they telling them that they were doing it. So again, just last week, family members of the late Henrietta Lacks made progress toward getting justice for the Baltimore resident and cancer patient whose cells were stolen by doctors 70 years ago and used to advance global medicine and science. The family won a settlement against a pharmaceutical company that profited from the use of the immortal HeLa cells. HeLa, short for Henrietta Lacks, in its products. But some black folks ask how many more Henriettas are out there whose names and medical traumas have yet to be discovered. I'll read that one again. But some black folks ask how many more Henriettas are out there whose names and medical traumas have yet to be discovered. One thing's for sure, these experiences may have lasting implications. The effect of racism in healthcare. Researchers are still quantifying the impact of unfair medical treatment on children and their parents, but they recognize that direct exposure to racism during childhood and indirect exposure mediated through a parent's or caregiver's experiences are associated with a range of adverse health effects, such as poor birth outcomes and worse child, mental, social, emotional, and general health. When they start going through that babble stuff, they just trying to do more projecting in my book. Unfair treatment in clinical settings may therefore affect the health and well-being of both parents and children by causing psychological and physiological stress responses, which the author wrote. Disruption in healthcare and growing medical mistrust are also among their concerns. There's a need for accountability. The team recommends building systems of accountability into institutions to prevent mistreatment, including creating feedback loops for health insurance plans to document instances of unfair treatment by providers through patient satisfaction surveys. Now, before I finish this last paragraph, this was something I mentioned to somebody, I guess within a month or so, where I was saying that maybe there should have been, if doctors had the wherewithal or the caring to every now and then, when it comes to black people anyway, to ask them about either medicines that they were, prescribed before, and being able to document on a computer. I guess they would have to document it on a computer, to where a computer can kind of draw out a grid or a bar graph or something like that, to where it starts showing every time these black patients come in, like what would they be treated for? Did the medications work? Did it make them worse? And who were the doctors as far as their race is concerned? And that way they can start keeping track of and seeing if there's a pattern forming when it comes to black people with unfair treatment in the medical field, health industry, healthcare, and so on. I think that would be pretty beneficial as far as documenting mistreatment or medical apartheid. All right. Lastly, such efforts could document patient experiences, and outcomes by race and ethnicity, and establish criteria for determining whether providers and office staff members are qualified to provide culturally competent and effective evidence-based care as part of performance evaluation. Not even about per se, yeah, you could say qualified, but they're what's really in some of these folks, all right, as far as their hatred or non-hatred towards Black people, all right, because you can't train what's in somebody. You can't train that out of them. And I'll talk about more about that on another news report that we're going to cover in the very near short future. All right, we'll get back into what you can train in and out of people. All right, so like I said, medical apartheid is still real. It's going on, and it looks like it's going to continue going on, unfortunately. And it's being done to children and their parents. And whether or not a person is a parent or not, they're just doing it to Black people, period. All right. Like I said, I've been around and had to ask some questions when someone I know, a couple of people actually, were getting certain types of surgeries or getting certain types of medicines. You got to start questioning folks, because if not, they'll just leave you high and dry and then be on to the next. And then, like I said, there's mistreatment on certain groups, ethnicities of people, and there are better treatment on other ethnicities of people. So again, this is real stuff, man. Medical apartheid is for real, for real. People getting killed in the hospital on a certain type of surgery, and it keeps happening to Black folks, and then the same surgery they do on somebody else always seems to come out just fine. Same thing with medicines. The same medicines given, different from one compared to another. Another thing, real quick before we get out of here, and who knows, this thing might come up again in the future. Although I did a podcast on Robert Kennedy and his little shucking and jiving, if you will, when it comes to reparations, he did mention something regarding, and it was not only him, there was another white guy. I think he's a scientist named Mike Adams. It's interesting, like, some of these white folks will come out and tell the truth while the masses of others want to keep you in the dark. That's kind of interesting. That's another thing for another time. But there was mentioned that they can now, they meaning scientists or whatever, doctors, mainly scientists who create these, whoever creates these medicines and stuff, these, I think it's in regards to mRNA, can be modified to do certain things to certain groups of people racially. And for all the folks that sit up here and listen to this and go, man, that's some bull, that just seemed like some nonsense, that's that old funny science. Okay. You just keep that in mind and you believe what you believe. And I'm going to go with what I've seen, what I've researched and looked at and observed. All right. So you guys let me know what you think about this particular report. And like I always say, no matter where you are around the world, you can always bet on the new Black media. With that being said, this is What's the 411 News. We'll be back again. I'll holla at you. Peace. Welcome back to What's the 411 News, where we bring you news observation, interpretation, and news commentary from an FBA and BGR perspective. Let's get it.